And there seems to be widespread agreement, regardless of which party you talk to, that prices are just too high. But the disagreement starts over whose fault it is, I think. Who along the supply chain is most to blame for high drug prices?
I don't think it's productive to try to say most to blame. Listen, at the core, who sets their drug price? The drug company sets their drug price. So in the first instance, the drug company's to blame for the price they set. They're setting the price, okay? Nobody's controlling that. But then it's a very, very strange system that we have, just the way contracts have gotten written over the last couple of decades in the channel, that every single player in that channel, drug company, pharmacy benefit manager, and wholesale distributor, makes more money, given how the contracts are written, on a higher list price. And as the list price goes higher, they make more money. They will lose money with a lower list price. And we're facing that today because we have, as I've said, we've had several major companies with major products reveal to us that they are looking at and want to make substantial and material cuts in their list prices of their drugs. They are facing challenges working through these contractual arrangements so that they're not put at an instantaneous competitive disadvantage by having a lower price. Because the way contracts are written for remuneration is a % of that list price. I think it'll work out. I think it is such a good thing if list prices can be lower, that the players in the system, I think the major employers and the major insurance companies, including the folks who were just sitting here before us, I think will demand that everyone figure that out. They're adults, they can figure this out. Contracts can be written and reformulated to make this work. It's good for and it's good for patients. That's voluntary action, but of course we have a comprehensive, I think, revolutionary agenda for driving that to happen. So listen, if they do it on their own, that's great. They've heard the message. The president's made it clear where this system's going. Like Wayne Gretzky, they can skate to where the puck is going, great. But that puck is going there, and the rest of our agenda is to drive it there.
So does this necessarily mean getting rid of, would you advocate for actually getting rid of rebates, and how can you do that within your capacity?
So I have said before that I believe that under the anti-kickback statute, which created the rebate safe harbor for pharmacy benefit managers, that what one creates, one can take away. I think that is a reasonable and appropriate response. We need to look at that. There are complexities there. We would want to get comment on that because that is, of course, restructuring an entire segment of the economy and how that works.
And you're just talking about how this applies to Part D plans.
Primarily, the anti-kickback statute would be Part D, but I don't want to conclusively state the full reach of our regulatory authority or the import of the anti-kickback statute.
So should we be?
I was to be deliberately ambiguous there.
Well, but are you're taking steps toward that end? You said you're looking into it.
We are indeed working on that.
Okay.
Looking at how one would move to, as I said, a fixed price discount model to look at that instead of a rebate model around pharmacy benefit manager pricing.
And that's something that could be done through the regulatory process, so it would be a proposed rule.
I believe that's something that we could look at through rulemaking, of course, under our authorities under the anti-kickback statute. I've said this all publicly before. That's in the blueprint. It's in the president's blueprint that we want to look at and seek comment on moving towards a fixed price discounting model in the pharmacy benefit manager arrangement. We also, importantly, would like to look at banning all remuneration to pharmacy benefit managers from pharma companies. Because right now, if you're a pharmacy benefit manager, you're making money on the rebates that you're getting. You may be holding back a bit of that, again, based on a % of list price. You're also making money on administrative fees, which again are based as a % off of list price, and there may be other remuneration in there. And I believe it is a legitimate topic for us to discuss and to consider to ban all remuneration from the very entities you're supposed to be banging on to get the best discounts and lowest prices possible. The pharma companies instead receive all of your remuneration from the entities who you're serving, your customers.